Hello, my name's Neal Fernandes, and today I'll be discussing the global health impact of waterborne diseases. So first, a little bit about me. My name's Neal, and I'm a rising junior at Lambert High School in Suwanee, Georgia, in the United States. Outside of school, some of my extracurriculars involve being a Georgia Hostess State officer, a clinical intern, a co-founder of a local nonprofit, and a summer research intern. In the future, I plan to pursue a career in neurosurgery. So, what are waterborne diseases? Waterborne diseases are illnesses caused by recreational or drinking water contaminated by disease-causing microbes or pathogens. In simpler terms, it involves drinking or coming in contact with water that will make you really sick. So, why are waterborne diseases a global health issue? First, they have a high prevalence. Waterborne diseases affect populations across the globe. In fact, as of 2021, over 2.2 billion people worldwide lack access to safe drinking water. Next, it's a global transmission issue. Waterborne diseases can transcend borders and impact global health security. Outbreaks of these waterborne diseases are known to cause epidemics and pandemics. Next is the public health impact. Waterborne diseases significantly impact public health and cause widespread mortality. Lack of infrastructure hinders growth in these developing communities. And lastly, it has socio-economic implications. The cost of medical treatment and lost productivity place a huge burden on affected economies. Developing economies are stuck in the cycle of poverty and sickness. Let's take a look at the numbers. 3.4 million deaths are caused by waterborne diseases each year. 80% of all illnesses and deaths in the developing world are related to waterborne diseases. And 260 billion is lost globally each year due to lack of basic water and sanitation. Clearly, waterborne diseases have a huge global impact. Let's take a look at some of the common waterborne diseases. First is cholera, which is caused by bacteria and has symptoms of vomiting, profuse diarrhea, and dehydration. It can be treated by rehydration therapy and sometimes antibiotics. Next is typhoid fever, which is also caused by bacteria and can have symptoms of fever, headache, and abdominal pain. It can be treated with antibiotics. Next is giardiasis, which is caused by a parasite and has symptoms of diarrhea, cramps, and bloating. And it can be treated with antiparasitic medications. Next is salmonellosis, which is caused by the salmonella bacteria and has symptoms of diarrhea, nausea, and fever, and it can be treated with rehydration therapy. Lastly is dysentery, which it has symptoms of bloody diarrhea and fever and can be treated with rehydration therapy and in some severe cases, antibiotics. So what are the causes of these waterborne diseases? First is contaminated water, which contains fecal matter from humans, animals, improper sewage disposal, agricultural runoff, industrial pollution, or inadequate water treatment, which can all cause these waterborne diseases. Next is poor sanitation, which involves lack of access to basic sanitation facilities such as toilets and sewage systems, which can lead to open defecation or improper disposal of waste. And lastly is inadequate hygiene, which is lack of hand washing, improperly treated cooking water, and consuming beverages with animal interactions. Let's take a look at the effects. First is the economic burden. You have lost productivity because a lot of your workforce is out sick. You have medical expenses and water management to clean up all these infected and polluted waterways. Next is the healthcare system burden, which is sometimes overwhelmed and overcrowded with a bunch of people who are falling sick from these diseases, which in turn have a result of a medical supply shortage. Next is morbidity and mortality, where you have increased illness and deaths and overall a lower quality of life, especially in underdeveloped communities. Lastly is educational disruption. You have reduced school attendance because a lot of these kids are falling sick from these diseases. And then if there's a lack of clean water nearby, students have to resort to walking miles to just get access to water, and they're doing this instead of going to school. Now let's compare the global responses in developed countries and developing countries. There's a major gap between healthcare access, water treatment, and overall safety standards between these two countries. First, let's look at more developed countries. They have centralized water treatment plants that involve coagulation, filtration, and disinfection to make sure all the pathogens are gone. They have comprehensive water distribution systems for all public areas that involve regularly monitored pipes and other systems. And they have access to hospitals, medications, and trained health professionals in case you end up falling sick. Now, on the other hand, in less developed countries, you have scarce and poorly maintained water treatment facilities with sometimes outdated technology. In most areas, they're forced to rely on contaminated wells, rivers, or communal taps to distribute water. And if you do fall sick, you have insufficient healthcare infrastructure with limited hospitals, limited medications, and limited trained professionals. What are some of the prevention strategies? First, you have water treatment methods, which involve investing in water treatment facilities and technologies that promote filtration, disinfection, and boiling to remove pathogens. Next up is sanitation and hygiene improvements. You have to make sure to use covered containers to store water, ensure access to toilets and sewage systems, and promote regular hand washing with soap or sanitizer. Lastly is health education, which just involves providing information on waterborne diseases and these possible prevention methods. Encouraging communities to adopt safer practices in sanitation and food handling is very important, along with advocating for greater monitoring of water quality and infrastructure. So now, what can we do? The majority of waterborne diseases are preventable. So here are 3 steps we can take to help solve this crisis. Number 1, prioritize education. Inform affected populations about the risk of waterborne diseases, the importance of safe sanitation practices, and simple preventative measures such as boiling through comprehensive community programs. Number 2 is build infrastructure. Develop water treatment facilities, expand water distribution services, and maintain sanitation systems to enhance public health outcomes. And number 3, strengthen funding. Foster collaboration among countries, organizations, stakeholders, and everyday people to secure sufficient funding for waterborne disease prevention and research to ensure global health equity. Here's some of my references. And I'd like to thank you guys all for listening and watching to my presentation. If you have any questions or want to reach out, here's my name, my email, and my LinkedIn. Thanks once again for watching.